A patient comes to me and says, "Doctor, my testosterone is low. That is why I feel tired, foggy, and unmotivated." Here's the part most people don't expect. Sometimes testosterone is not the real problem. And treating testosterone alone in those cases does not actually fix how the patient feels. My name is Slava Fuzayloff. I'm a board-certified internal medicine physician, and I work extensively with testosterone and men's hormone health. Let me walk you through how it looks like in real clinical practice. Low energy, low libido, brain fog, poor sleep, weight gain. These symptoms are often blamed on low testosterone. And sometimes that is correct. But very often, testosterone is just the marker, not the cause. Here is something patients rarely hear. Testosterone goes down when the body is under stress. That stress can be poor sleep, insulin resistance when you're pre-diabetic, obesity, especially fat around the belly, chronic inflammation, if you have any medical condition that's causing it, untreated sleep apnea when you're snoring at night, overtraining when you're over-exercising, and under recovery when you're not resting enough after exercise, physiologic stress or psychological stress or certain medications. In these cases, testosterone drops because something else is wrong. This is where problem starts. If you raise testosterone without addressing the real issue, energy may improve briefly, then fade. Symptoms don't fully resolve. Doses keeps going up. Side effects appear. Patients say, "My number look great, but I still don't feel right." I see this all the time. A patient comes in with low normal testosterone, but when we look deeper, he sleeps 5 hours a night. He has untreated sleep apnea, snore at night. Fasting insulin is high, pre-diabetic. Cortisol level is elevated, stress-induced. Inflammation markers are abnormal. Testosterone is not the root of the problem here. It's a canary in the coal mine. In the proper medical practice, the question is not, is testosterone low? The real question is, why is testosterone low? Because fixing the cause often improves testosterone naturally, or makes TRT, which is testosterone replacement treatment, actually work the way it's supposed to. Many online TRT clinics focus on one number. If testosterone is below the cutoff, they prescribe. No sleep evaluation, no metabolic assessment, no context. That's how patients end up on lifelong treatment without feeling better. Low testosterone is real, but it's not always the real problem. And if you don't identify the underlying cause, you are treating a lab value, not a patient. If you like this presentation, please click on the like button, subscribe to our channel, and we're going to be posting more videos.